So today we're going to talk about the brain bank. But why? Why? Anybody knows what is dementia? Sometimes someone goes and they said, well, the doctor said I have, my mom has dementia. And dementia is an umbrella term. They have to be more specific. They have to tell you which type that your person has, which is very important. And that's what the brain bank come in when the person, it's a post-mortem research study. And when the person passed away, what we do the procurement of the brain here at Arnold Palmer Hospital, and we will do the autopsy of the brain at Mayo Clinic. And it's a free program, and what they do, they try to find out what went wrong, what is going on with the brain when you were alive, when the person was alive. Is it Alzheimer's disease? Is it a mixed dementia? What is it? And what we found out, sometimes they were diagnosed with Alzheimer's disease, and when we did the autopsy, it wasn't Alzheimer's. It was Lewy body dementia, or they have both Alzheimer's disease and Lewy body. So it's important for the doctor and the family to know about what happened, because they will know better how to care for their next patient, what type of medicine they should give, because not everybody, you cannot give to a person with Lewy body dementia medicine for Parkinson. You know, that interaction, they can make them behave another way, and it can be deadly as well. So it's very important to know what type of dementia you have, okay? It's easy to apply for the brain bank. We just have the application. You have to provide information pertaining to blood work that was done for your loved one, so we can rule out certain illnesses. Because if a person has, for example, diabetes, and they don't control it, they can look or act like they are troubled, they have problem thinking or reasoning. And also, if they have problem with their thyroid, and the thyroid is like a gland, like a butterfly gland here, and it affects your entire body. It controls your entire body. So if you have problem with your thyroid, you may act like if you had memory issue, if it's not controlled, if you're not taking your medicine properly. And you may have mini strokes, or you may have had some tumors in the brain and you are acting like you have Alzheimer's disease. So this is why it's always important to go to the doctor, to have your routine checkup. They test your blood work to see if you don't have any cancer, because you may act differently, and someone may say, my mom has memory issues, or maybe it's a UTI. Because when they have an infection, they may act like they are not in control of anything, or they cannot think properly. Okay, so I had put some stats here. Alzheimer's disease is the 6th leading cause of death in the US, and they have around 6 million of people living with that illness here in United States. It's a lot. So who's caring for those people? You guys. You are caring. You're caring for 2 or 3 people. That's a lot. And that's a toll on caregiver, on the economy, because you have to leave your job, you have to care for somebody, or you need respite and work at the same time. So it's not like only your concern, it's like a community concern. Everybody should be involved in helping you, caring for your loved one, right? So this is what we were talking. Are irreversible dementia, like Alzheimer's disease, vascular dementia, Lewy body, Huntington disease, any other mixed dementia. But if your person is diagnosed with CJD, we will not accept these cases with the brain bank. It goes in a special place in United States. I don't recall in which state they receive all the CJD's cases, but when you call, we will let you know. So the brain bank has been established in 1987 by the Florida legislature, and it started at the ADRC with Pat. Pat Jemison was the founder of the ADRC, and her husband had Alzheimer's disease, and she didn't find any place to help out. There was no support group, so she started this with Dr. Pearl and Dr. Dwara. And Dr. Dwara is still at Mount Sinai Medical Center in Miami, and I speak to him from time to time. So what do we want with the brain bank? We want to find a cure. Just for you to know, when you're seeing your person acting out, saying like, I don't remember, or saying that, what time is it? Or have we eaten already? And you said, we just ate. And they come back 2 or 3 minutes after that and they ask you, when are we eating again? So you can say, oh, something is wrong. We cannot just deduct like, oh, maybe she has a UTI or maybe it's Alzheimer's disease. You have to go to the doctor so they can do some testing. They will do first the blood test to find out, to rule out everything I said. And if they do see everything is normal, then they will refer you to a neurologist so they can do more scan and other tests. What happens when they do find out that you have some form of dementia? Those cells have been destroyed 15 to 20 years prior. It's just manifesting, the condition now, but it was doing all the plaques, all the amyloid was just gathering or destroying, your brain at that time, like 15 to 20 years prior, okay? So we would like to improve the diagnostic testing with research, because they will develop better equipment to detect the illness earlier. Because usually what I have, the family goes to the doctor, said something is wrong with my wife or something is wrong with my mom, and they do well in the test. They give them an MMSE test. It's great. They don't see anything. They can converse. They don't have any problem. They do an MRI. They don't find anything. So if we can develop better equipment to detect, what's going on, or if the person is most likely to develop the disease in 10 years or in 20 years, at least maybe we can find some cure or some type of medicine that can prevent the destruction of the brain cells. So this is why we are doing research. And also with research, it's not only medicine. Oh, you're sick, then we give you all the meds in the world so you can slow down the illness. It's also how do we have to interact with the person? How do we have to speak with that person? We will not say, we know now, we will not say to the person, you asked me this question 10,000 times, Mom. You coming? No, we ate already. How many times I have to tell you, we ate? And if they have hallucination, no, Mom, there is nobody in the living room talking to you. So we will not say that to a person living with the illness. We will understand that's not their fault. That's the brain that has been damaged. And we will step back, even if we are frustrated, and we will live in their world. We have to step into their world and communicate with them as if, yes, there was a person in the living room. You're not lying. Some daughters or sons saying, oh, Alexandra, I'm a Christian. I'm going to lie to my mom? No, you're not lying. You are in their world. So they see somebody, you say, oh, okay, in the living room. He came to check the air conditioning. That's okay. Don't worry. Don't, so they will not be agitated. They will not be scared. So if they hear voices or the kids running in the yard, oh, don't worry, Mom, I will ask them to play further down, so they don't disturb you. But don't contradict them. Why would you contradict them? You will fight, they will be anxious, and then what will happen? You will have a bad day, they will have a bad day, and they will think that you are not in their team. You are not a person to be trusted because you're always fighting, contradicting, being negative, blah, blah, blah. So you want to be in their team and in their world. So you're going to promise me if you're taking care of your mom, your dad, or a spouse, you are going to become the best actors and actress in the world. And I say red carpet, Academy Award actors you'll be, because you're going to be in their world. It's like they're giving them a script. You cannot go, have your own script in their world. It's a movie for them. It's what they are seeing. So be mindful of that. Okay? So who is eligible to enroll? 18 and over 18. Okay, with a diagnosis of memory issues, or if your brain is fine, you can donate it as well, because it's good for us to compare, sane brain, a brain that has no problem, no memory issues, no tau buildup, no amyloid plaque destroying cells, to compare and find a cure. So this is what you have. And if you don't know, if you have a doctor saying all the time, oh, it's just old age, you have memory issues, that's not acceptable, to say it's only old age. If you are not sure, you have memory disorders clinic around here in all the state of Florida. They have a lot of memory disorders clinic. Okay, you can go there, they can test you, they have a great team. Here we have at Advent Health, Dr. B, we call her Dr. B, Dr. Valdivieso, and you have Dr. Rosado at Orlando Health. You have the Memory Disorder Clinic in Brevard. You have Dr. Visa, we call her, because her name is long and I cannot pronounce it. So Dr. Visa, and we have a lot more around the state. So just make sure you find the right doctor, because sometimes I know we love our doctors, we don't want to change, but make sure you don't have to leave your doctor, but go to the memory disorder clinic and you will have a team of people helping you. You have the social workers giving you resources. You have the nurse and you have the doctor. And the doctor will not say, well, it's 10 minutes, we're done. This will spend like an hour with you, 45 minutes or more. They don't look at the time. They are sitting with you and helping you through that journey. And it's not only the patient, but also the caregiver. They care for the caregiver. Okay? What do we need to be accepted? A full neurological workup. And you do that already when you go to the neurologist. Full service for funeral home that has been identified, or a cremation place. But don't worry, when we do the procurement, the incision is done in the back. You will not be disfigured. You can have an open casket. You don't have any, you can go ahead with your plan, your funeral plan. And transport, if it's in Central Florida, usually most funeral homes, they don't have any problems taking the body to Arnold Palmer Hospital for us. But in case they want to charge extra for the transport, you just let me know. And with the grants that we have, we will cover it. We will cover the transport costs. And we will have our own contracted transport companies. Okay, so we were talking about that. In the neurological workup, that's what you do with the doctor. They will interview the patient. They will give you some type of test. They will find out as well your past history, and your family history, if you had anyone in your family who had those symptoms. We talked about that. This is why you will go to the doctor. They will want to rule out those things. Diabetes, that you're taking your insulin properly, you're not missing anything, you're not drinking. It's not because you're drinking that you're having some memory fogs and you're not able to think properly. If you're depressed, if they are addressing depression or the thyroid problem, it can reverse that dementia. So it's important for you to go to the doctor. And these are the little tips I put for you. Don't argue. You can provide orientation. And you encourage them when they are not doing well. Or if they are doing well, if they can fold their clothes, just give that to them. If they can set the table for you, just give them whatever they can do that can still use the brain cells. Almost done. Okay, so we can go over that later on. I wanted you to know that they have to have had a scan, an MRI or a PET scan, and usually they do when they go to the neurologist, they have that. I don't need any CDs, just the narrative pertaining to what they had found. I want you to see those, It's a normal brain here, and here it's a brain affected with Alzheimer's disease. So what is the difference? What do you see? What can you tell me? Red spots, more active. You have active, and here, very dark. That's where the plaques are. So you see why we cannot say to someone, do you remember this person? No, provide the words for them. Hi, Mom, this is Bill, our neighbor. Hi, Mom, this is John, your grandson. Just just give them the information so they don't try to retrieve, I know, but I cannot say it. They may have aphasia and they cannot find the right words, okay? So, we cover 21 counties, the ADRC, that's what I covered, 24 hours a day. We are available, so you know why we do the autopsy. Again, a normal brain and the Alzheimer's brain. So you see what we were talking about, how it shrunk. A normal brain is weight around 1,300 grams. And sometimes when we do the autopsy, it's 900, 960. Yesterday I had one that was 960 grams. So it's important, again, for us to know how to behave with them. That's not their fault. That's not Mom's fault. That's not Dad's fault, the way he or she is behaving. Okay, so somebody has to have the durable power of attorney, healthcare surrogate papers in order for us to do the brain bank. Or if you have guardianship, that's fine, but healthcare surrogate is great, okay? How will the autopsy benefit the family? You will know how to prepare for the future, how to plan for the future, especially if it's hereditary, or especially if you have high blood pressure, diabetes in your family, if vascular dementia in your family. You will know how to plan ahead with your long-term care insurance or durable power of attorney. Just remember, durable power of attorney is the most important document that you should have if you are over 18 years old. Otherwise, if you have only power of attorney, what will happen? It ends when the person doesn't have capacity, cannot make decision. But the durable power of attorney will last even if the person cannot function, cannot think, and has dementia, okay? We already said that. Plan ahead. What I wanted you to see, there is no cost moving forward, and this is the 24/7 number for the brain bank, and I am I'm there. My table is over there if you need more information pertaining to the brain bank. And thank you so much for coming today. If you need any care coaching or how to handle a person who is showing behavioral disturbances that you are taking care of, just call me. I will give you some tips. It may work today, may work tomorrow, may not work in 1 month. So you won't have to be like chameleons, adapt to the day, and do your best. Already you're doing your best, and thank you so much for coming.
Doctor,